Hello everyone, my name is Schachter. Thanks for spending some time with us today. Allow me to make some introductions about who I am and what we're going to talk about. My name is Schachter. I'm the founder and CEO of Axiom Real-Time Metrics. I want to talk to you today about ePRO in our changing world. For a little bit of background, Axiom has been running clinical studies for about 19 years, creating technology to be able to manage every aspect of the study itself. We run over 700 of them in multiple therapeutic areas, and there's a lot for us to talk about as to how ePRO plays into that. I want to give you just a little bit of an intro as to who we are and what Fusion is. So for those not familiar with us, Fusion is an eClinical suite. It is a unified platform designed to be able to conduct all aspects of pulling the information together within a study. Started life as EDC and has morphed over many years into RTSM, CTMS, ePRO, and many other modules. As I mentioned earlier, it's a unified platform, so it's single sign-on into every piece of information in your clinical study, and it really enables you to be in a position where you have a first-hand awareness of the critical information within your study, the things you need to know, and the decisions that you need to be able to make. As you can see, it involves all major aspects of pulling together clinical study data and therefore changes how you operate that study. The key elements around this we'll talk about at the end of our session, but just for some key critical considerations, the data between EDC, CTMS, inventory management, and your critical risk indicators obviously change how you run your clinical study. ePRO. ePRO has gained in the importance on an ongoing basis within our clinical studies. And of course, given the world that we live in today and the challenges that are involved in running clinical studies, of course, because of COVID and so many other reasons, the aspects of managing ePRO data has become an even more essential aspect of running our studies. So I want to take you through a little bit about what we do and then, of course, dive into the depth of the presentation. For some background, Axiom has been running ePRO studies for many years, capturing data from a tablet perspective, directly from the patient at the clinic, and of course on various handhelds, iPhone and Android, and managing all aspects of the ePRO compliance within a study. We're able to do this, as I mentioned, on multiple formats. So when the patient comes into the clinic and you're handing them that typical questionnaire, we can eliminate the paper-based questionnaire and capture all that data electronically. And then when they leave the clinic, we're, of course, in a position where they're now filling out all of their questionnaires on their personal device or on a study-provided device. Axiom is able to manage, excuse me, all aspects of that perspective in terms of providing the hardware, the software, and so forth to ensure that it is supported 24/7, and of course is in a framework where you as a sponsor don't have to take responsibility for managing those tasks. What I want to do is talk to you ever so briefly about a case study in managing an overall ePRO global implementation and what that was like for one of our clients. The key aspects I'm going to touch on are what the client's needs were, the key aspects in terms of the diary configuration, what the technology development approach was, and how we ensured we end up with clean data in the process. So we started off with a conversation with our client about what really makes a good partner. And I think you would agree that the 4 points on screen are really essential. So you need to be aligned on what the goals are for getting the overall piece done. You need mutual understanding of what are the most important aspects of the study, a strong understanding of the flexibility needed on both sides because studies are going to change, and obviously ensuring that the right support is there for end users to be able to get things done and get their questions answered. So our client came to the table with several needs. One was ePRO that was really powerful, but they really needed it to be easy because this was an overactive bladder study, and therefore the patient population are not people who are well-versed in technology and spending their days surrounded by it like many of us do. Number two, they really needed awareness of the inventory of their devices that were being handed out. And number 3, they wanted key visualization of all the information within the study, and they really needed to know where their risks were. So touching on creating a diary, they wanted the diary setup to be simple. They wanted to be able to put that diary in the hands of the patient and have it set up for that patient within about 90 seconds. So that meant handing them an iPad. The subject works with that iPad. They set up on their questionnaires. They complete them, and they hand them back, and then they're directly uploaded in real time so that they're available for clinical review. The diary setup, from their perspective, really was all about really straightforward information capture, one question per screen, so that they're really quick to be able to do, and wherever possible, don't have the patient go through the process of entering the date and time every single time they're completing it, especially if it's being done at this moment. To that end, some of the critical aspects were they wanted to support iPhone and Android. They wanted to have the patient be able to use their own device. We needed to ensure that all the data was there, of course, and that it was available in real time. And we really needed to be able to track their compliance. So we need to make sure that they're doing the right things all the time. And of course, as I mentioned earlier, we needed to be in a position where they were being supported. To that end, the goal of what we were doing in this study was, as often done in an overactive bladder study, is the idea of capturing that data for a segmented period of time. In this case, about 72 hours. So we want to be able to run a clock for that time every single morning, get them to be able to capture their entries, and obviously ensure that they're being compliant from that perspective of capturing the data. We also needed to plan for a backup process. Phones are great, but in the event that they couldn't have their phone, dropped it, lost it, stepped on it, we needed to be in a position to be able to capture the information from a paper-based perspective and be able to record those details as well. So the design process, if you're doing an e-diary study, the design process obviously absolutely critical. I won't read off all the goals that you see on this screen, but the fundamental importance is coming to an agreement between the study team and the technology and e-clinical vendor to understand exactly what you're trying to do. And of course, essentials are there. We need it to be friendly. We want to be able to do intelligent notifications and reminders to the patient. And we really want to be able to be in a position where we're doing the right type of checks when the patient is putting in data to ensure that we're capturing the right information. To that end, the process that we go through is an iterative process. We, of course, look at the information in determining the requirements. We sit down and make sure it's discussed. And then we go through an iterative process to go through, implement it, test it, go back, look at it again, and keep going in that circle until we believe that we've really gotten the right information down, and we're going to capture all the critical data from a study perspective. Of course, once you have the information assigned, now you're starting to get to the point where you're ready to access your study data. What's really important, though, is as the sponsor, now that we're going to capture it, how are we going to be able to see it? Who needs to see it? What are the visuals to be able to review it? And we need to be in a position where all of that data is in a position where we can have firsthand access to it 24/7 so that we know what's happening from a study perspective. Once that study is operational, you want to be able to have access to the data that meets your primary endpoint analysis. So in this case, we were grouping data into multiple categories around the endpoint requirements, starting in screening, going on to the ongoing endpoint analysis, and of course the critical and key endpoints from a study perspective. To that end, reports were designed that allowed us to grab all of the diary entries and put them together. One of the things you want to spend the least amount of time doing in your ePRO study is grouping data based on types of events. So you want the technology to do that for you and deliver it in a simplistic way that allows you to obviously make critical decisions. To that other point, on being able to see the data, we want a heat map. So you can see here it jumps out in green. So we want to be able to see critical data points that should be coming to our attention. And of course, be in a position where they're readily available to us, reporting access within 2 clicks. Lots of data is obviously an aspect of a study, and being able to grab the raw underlying data at any given time is obviously really important so that you can crunch the appropriate analysis as part of that process. Brings us all back to having access to that data. So Fusion is, as we touched on earlier, a unified eClinical platform, but more importantly, it's really about being the connected hub for all of your study data. It's about having at your fingertips the information that you need to be in a position where you're making all of the essential decisions. So how does that change when it comes to running your study? In many platforms, all of the components are independent, and you are left to pull them together, to pull the information together, to collate on a weekly or monthly basis. And this is an enormous amount of time that doesn't bring value from a study perspective. That's why, from a Fusion element, all of these modules are in one platform. They're single sign-on to every single thing that you want to know about the study. And of course, what that leads to is centralized dashboards for all of your study details, all of the critical information that's important for you to be able to run that study. It's what we refer to as data-driven studies. And from Axiom's perspective, you can really make smarter decisions, which leads to better results when you're in a position to have access to every single aspect of your data stream on a 24/7 basis. It also means that you're making decisions on a daily basis about the study instead of waiting for the teams to be able to collate that information together. Axiom's overall approach is to give you the critical aspects. So you'll notice the top of the pyramid is access to all of the study, regardless of whether that's clinical or operational data, gathering all of the data, and of course the modules and the services starting from data analytics, biostats, and so forth to be able to support them throughout the whole process. From our perspective, single sign-on translates to everything you see on this screen as just an example being at your fingertips 24/7, and therefore being in a position to really enable you to manage that study that much better. I just want to thank you for spending time with us today. I really encourage you to do a review of what we presented today and the aspects of owning your data relationship, as we've just touched on throughout this presentation. And I want to thank you for spending a few minutes with us via the Arena Direct-to-Patient event. And we obviously would be thrilled to talk to you further about how Axiom can meet your ePRO needs, and of course walk you through Fusion ePRO and all of the elements of our eClinical suite. Thank you very much, and have a great day.